Okay, good afternoon, class. Let me continue from our previous discussion. Okay. Okay, let me start from here. Hope I am audible to you all. Fine. How many students? 41. Only 41. Now let me proceed with how flow chart looks like. Okay, and this is common flow chart. Okay, we need to use in all types of disease under IMNCI. See, check for possible serious bacterial infection, PSBI, hypothermia, and jaundice. These three things are very important. You need to ask for, has the infant had convulsions? You need to ask, has the infant had convulsions? Like history taking. You need to ask with mother or caretaker. Then you need to look, listen, and feel. So during entire process, look, listen, and feel. Young infant must be calm. You need to count breaths in 1 minute. Okay, within 1 minute, for 30 seconds, full 1 minute. And if you find elevated breaths or respiratory rate, you need to repeat. But your young infant must be calm. Okay, not crying or irritable. So practically, it's difficult. So we try to maintain calmness as much as possible. Then you need to look for severe chest indrawing. Is there any chest indrawing? See, this terminology, chest indrawing, flaring, grunting, please read yourself, okay? I don't want to go detail, it's beyond the scope of this class. Look for severe chest indrawing. In Nepal, it's called kokhan. This is chest indrawing. By the way, the kokhar with diaphragm. Nasal flaring, nako pora pulne. Grunting, yeah. Look and listen for grunting. Unable to suck breast milk or feed. Feed means there may be other causes, like oral thrush, very low birth weight baby, some congenital deformities like cleft lip and palate, sometimes mother factors, abnormalities of nipple, retracted nipples. You need to exclude those conditions. In this feature, okay, under this feature, unable to suck or feed, you need to rule out those conditions. Look, hear and feel छाम for bulging fontanelle. Fontanelle means talu in bulging fontanelle. Look at umbilicus, navi. Is it red only or draining pus? Look for skin pustules, skin pustules. Not a single, but more than 10 or more than 10 skin pustules. Or big boil. Measure auxiliary temperature. If not possible, feel for fever or low body temperature, hypothermia. Fever or hypothermia. You need to see, watch. Young infant is lethargic, 0 to 2 months, or unconscious. Look at the young infant's movement. Are they less than normal? Look for jaundice. Are the palms and soles yellow? And finally, look for pus, draining from eye. Look, listen, and feel. So under this heading, you need to look, listen, and feel for these parameters. Now, based on acts, history taking, and your examination, look, listen, feel. Now we need to categorize disease or disorders as follows. You can classify young infants as PSBI. PSBI means possible, serious, not severe, serious bacterial infection. So what are the criteria? If only convulsion or fast breathing, 60 breaths or more than 60 breaths per minute or more. So if it's 0 to 2 month children, infant, if it's 60 or more than 60 breaths per minute, then you can suspect for PSBI or pneumonia. Or either convulsion or fast breathing or severe chest indrawing or nasal flaring or grunting, unable to suck or feed or bulging fontanelle or umbilicus redness around skin area, or if exhaled temperature is 37.5 degree, feel hot to touch or without thermometer, and the temperature is less than 35.5 degree, that is feel cold to touch or hypothermia. More than 10 skin pustules or a big boil or lethargic or unconscious or less than normal movement. Then these all are or, okay, means single symptom or sign is enough to say infant having PSBI, possible serious bacterial infection. Then what's the management? You need to inform the parents or caretaker about seriousness of the condition, then emphasize on immediate need of treatment. Taking parents consent. You need to take parents' consent and give immediately first dose of amoxicillin and continue orally twice a day for 7 days. So drug of choice is amoxicillin orally. Another one is injection gentamicin intramuscular once a day for 7 days. Amoxicillin BD twice a day. Gentamicin injection once a day for 7 days. Hypoglycemia is the another issue. So ask mother to breastfeed to prevent hypoglycemia. Advise mother about KMC to keep infant warm. KMC means kangaroo mother care. KMC. So what is KMC? Please Google it. You can find lots of videos. Though I have videos related to KMC or kangaroo mother care. I'll try my best to share link of those videos. Avoid mother about KMC. Sorry, advise mother about KMC to keep infant warm. Actually, it's a kangaroo mother care. Secure. It's like caring children. Like how the kangaroo cares his baby in their pouch. Okay, it's like that. So we can use either mother or father or kangaroo mother care. It's basically to keep infant warm. Breastfeeding to prevent hyperglycemia. If parents refuse, okay, for treatment, sometimes this happens. Or condition worsens on day 3, you need to follow the treatment. You need to reconsider your diagnosis. Sometimes we need to go for another diagnosis. So after this emergency management, you need to refer urgently to nearby hospital or healthcare providers. This is about PSBI. Where you need to refer. Okay, PSBI in this condition you need to refer. Then LBI, local bacterial infection. Umbilicus red or draining pus or less than 10 skin pustules or pus drainage from eye. So these are local infection, either less than 10 pustules or pus drainage from the eye or umbilicus red or draining pus. So you need to categorize it LBI, local bacterial infection. Immediately give first dose of oral amoxicillin and advise to continue for 5 days twice a day. Here only for 5 days. Teach mother to treat local infections at home because it is OPD based treatment. And advise to provide newborn care at home. As well as advise mother when to return immediately if there is any sign and symptoms related to severity or serious bacterial infection, which is just discussed in my previous slide. Then you need to ask mother to return immediately to their center. So in a normal condition, you need to ask them for follow-up in 2 days. This is LBI or yellow zone. If none of the above sign and symptoms occurs, then NBI, no bacterial infection. Still, your job is advise mother for newborn care, teach them best newborn care approach, ask for EBF, exclusive breastfeeding, and teach them how their baby keep baby warm. Okay? And you need to advocate for immunization process or any mass drug administration. But your duty is to inform them about danger signs of infections and advise for immediate treatment in nearby outpost or hospital. This is about PSBI, LBI, and no bacterial infection. 3 conditions for young infants 0 to 2 months. Now, if the infant has jaundice, then what you need to do? Sign and symptoms: palms and soles yellow or age less than 24 hours or age more than or equal to 14 days. Palms and soles yellow. Okay, if palms and soles yellow, then you need to consider about age also. If it is less than 24 hours or more than 14 days, if in between, then we can say physiological jaundice. So the time duration or time is important here. Severe jaundice means rate. You need to inform the parents about seriousness of the condition and emphasize on immediate need of treatment. Taking parents' consent, give first dose of injection gentamicin. Continue breastfeeding every 2 hourly to prevent hypoglycemia. Refer urgently to hospital and advise mother how to keep the young infant warm on the way to hospital. Kangaroo mother care or other approaches, covering with blankets. Okay. This is for severe jaundice management. With available emergency treatment and methods, advice, you need to advise for referral to better center or hospital where pediatrician or equipments are available. This is for severe jaundice or red zone. Jaundice, yellow zone. Okay, palms and soles not yellow. And age 2 days to 14 days. Second day to 14th day. This may be physiological jaundice. So you need to advise mother to give home care for young infants. Advise to keep young infants naked in early morning, direct sunlight for 1 to 2 hours. Okay, directly to sunlight. Then ask them to follow up a third day at the health center. And advice for exclusive breastfeeding as always. Okay, and advice exclusive breastfeeding. Okay, which is necessary. List. Okay. Advise mother how to keep the baby warm and advise when to return immediately. These all are important treatment or management strategy, either as a drug treatment or advice or some home remedies. Okay. This is for jaundice. Another condition is hypothermia, low temperature. If body temperature is less than 35.5 degrees centigrade, then you need to categorize it severe hypothermia or red zone. The possibility are PSBI, so treat for PSBI. For that, give amoxicillin, gentamicin. Ensure warm room temperature, KMC, kangaroo mother care. Give extra blanket to mother and child. Breastfeed every 2 hours to prevent hypoglycemia and even hypothermia. Assess at grade 3. If not improved, you need to refer. Severity, hypothermia. Then only hypothermia, yellow zone. Body temperature 35.5 degree to 36.5 degrees centigrade. Then you can consider them under hypothermia. Okay. You need to care for children at their home. Put in normal room temperature. That means 25 to 28 degrees centigrade. Definitely ask for KMC, kangaroo mother care. You need to give extra blanket to the mother and child. Breastfeeding every 2 hours. Assess at day 3 and refer if not improved. Then the most important part is you need to inform when to return to health facility. Okay? When to return to health facility, you need to inform them. This is about hypothermia management. Okay, so PSBI, jaundice, and hypothermia. We discussed about 3 conditions. Now let's move to other conditions. Then asks, does the young infant have diarrhea? Because they may present with more than one symptom. I already told you in my next studies class, the previous class. So you need to ask for diarrhea also. If it's asked for how long? Duration. You need to rule out dysentery. For that, if blood in stool, is blood in stool present or not? You need to ask to the caretaker or mother. This is about the history. Then look and feel. Look at the general condition of infant. Is the infant lethargic or unconscious? Restless and irritable? Look at the infant's movements. Are they less than normal? Then is actually baseline movements, means before having these problems, mothers can easily distinguish less movement or more movements of infants. Sometimes subjective variation. Pinch the skin of abdomen because it's a diarrhea. For that, you need to assess dehydration. Does it go back very slowly? That means longer than 2 seconds or slowly. After that, you need to assess for dehydration with diarrhea. So what are the diagnoses for this condition? Diarrhea with severe dehydration, diarrhea with some dehydration, and diarrhea with no dehydration. Based on this, we have different management plans. This is based on IMNCI, but people used to say mild, moderate, and severe. Okay, actually under IMNCI, it's not. It's diarrhea with severe dehydration. For that, you need to start plan C treatment. Some dehydration, plan B, and no dehydration, plan E. Diarrhea with 2 of the following signs: lethargic or unconscious, less than normal movements, sunken eyes, or skin pinch goes back very slowly, or less than 28 days in hands. Then you need to classify as diarrhea with severe dehydration. And you need to start plan C treatment. So what is plan A, plan B, and plan C? Please repeat. Okay, this is important. You can Google it and you can find, or you can find in YouTube videos also. But I'll try my best to cover here basic important points regarding plan C treatment. For that, you need to give first dose of injection, ampicillin, not amoxicillin. Amoxicillin oral, ampicillin injection, and gentamicin IO. Then refer urgently to hospital with mothers giving frequent sips of ORS on the way to hospital. Oral rehydration solution. But you need to ask mother, advise mother to continue the breastfeeding, okay, if possible. But we need to advise these things, okay, because breastfeeding is good for prevention of hypoglycemia and hypothermia too. Then it is for KMC. This means advise mother how to keep young infants warm on the way to hospital. That is kangaroo mother care. This is for severe dehydration. ORS, injection ampicillin and gentamicin. KMC and breastfeeding is the management for plan C. But how to give ORS? Okay. Or do we Do we need RL, ringer lactate? Definitely we need ringer lactate for plan C treatment. Start plan C treatment means plan C means ringer lactate solution. And despite ringer lactate, we need to manage with some antibiotics. According to IMNCI guideline, ampicillin and gentamicin, then we need to give ORS, ask for breastfeeding and prevention from hypothermia. If two of the following signs, either only restless or irritable or sunken eyes or skin pinch goes back slowly, then some dehydration. Plan B treatment. Plan B. So plan B treatment plus advise mother to continue breastfeeding. Follow up in 2 days if no improvement, and advise when to return immediately. If there is not enough sign to classify as some or severe dehydration, diarrhea without any sign and symptoms is above, then diarrhea with no dehydration, initiate plan A. Plan A means give fruits to treat diarrhea at home management based on fruits available at home, and ORS 2. Advise mother when to return immediately and follow up in 2 days with no improvement. So this is about diarrhea with dehydration. I already told you that we need to ask for duration of diarrhea. If it's more than 14 days, then we can say it's a persistent diarrhea. So diarrhea lasting for 14 days or more, then severe persistent diarrhea. Definitely you need to provide rehydration therapy, ORS, ringer lactate. If young infant has dehydration but no sign and symptom of possible bacterial infection, still you need to refer to hospital for severe persistent diarrhea to identify the actual cause, to investigate the cause of persistent diarrhea. Why we need to ask blood in stool? Blood in stool or mucus means tentatively we can diagnose as severe dysentery. Dysentery, give first dose of intramuscular antibiotics and refer urgently to hospital. Advice to continue breastfeeding and advise how to keep young infants on the way to hospital. These are all about some diagnosis or disorder or symptoms and signs. Despite these, you need to check for feeding problems and malnutrition, because malnutrition and feeding problem is common in our context. Ask, is there any difficulty in feeding? Is the infant breastfed? If yes, how many times in 24 hours? Does the infant usually receive any other food or drink? Because up to 6 months, we are expecting EVF, exclusive breastfeeding. But in our society, in our cultural perspective, they used to feed with some liquids and other foods, despite exclusive breastfeeding. If yes, how often? What type of food? What do you use to feed the infant? Bottle feeding, spoon feeding, or bowl feeding? Then look and feel. Determine the weight for age. You need to ask for age. It's up to 2 months. Then measure the weight and calculate weight for age. Look for any ulcers or white patches in the mouth. There may be thrush, oral thrush. You need to look for this. Ask mother to open their children's mouth and look for patches or thrush. If an infant has any difficulty in feeding or its breastfeeding is less than 8 times in 24 hours. 8 times in 24 hours. Okay. 8 times in 24 hours, or is taking any other foods or drink, or is low weight for age, and has no indication to refer urgently to hospital. In these conditions, you need to be careful. You need to also assess for breastfeeding. Has the infant breastfed in the previous hour before bringing them to in your chamber or hospital or emergency or OPD? If the infant has not fed in the previous hour, ask the mother to put her infant to the breast and observe the breast for 4 minutes. If the infant was fed during the last hour, ask mother if she can wait and tell you when the infant is willing to feed again. To observe the breastfeeding process, you need to look for, is the infant able to attach? No attachment at all, not well attached or good attachment. So how to check for attachment? Look for chin touching the breast. While breastfeeding, the chin touching the breast, mouth wide open, lower lip turned outward, more areola visible above than below the mouth. All of these signs must be present if the attachment is good. For this, please go to YouTube videos. You can find many YouTube videos related to attachment and others. Maybe in my next class, I'll show you videos. So based on this, is the infant suckling effectively? That is slow, deep sucks, sometimes pausing. Effective means slow, deep sucks with pausing in between. Pause in between. Not sucking at all, not suckling effectively or suckling effectively. Sometimes you need to check for blocked nose. Sometimes it interferes with breastfeeding. Sometimes you need to check for cleft lip and cleft palate or oral thrust, which hampers suckling. So you need to be more wise enough, okay, before giving your conclusion or summary or your diagnosis. Then you need to assess for immunization of young infants. This because immunization is one of the top priority program of our country and which prevents from future disease. So we need to ask for immunization. Then you need to classify the young infants feeding, okay, based on these signs and symptoms: not well attached to breast or not suckling effectively or less than 8 breastfeed in 24 hours or receives other foods or drinks or low weight forage or thrushes, ulcer or white patches in mouth. Then feeding problems or low weight. What you need to give? On-demand feeding during day and night time. If not attached or not suckling effectively, teach correct positioning and attachment. If breastfeeding is less than 8 times in 24 hours, advise to increase frequency of feeding. If receiving other foods or drinks, counsel mother about breastfeeding more, reducing other foods or drinks and using a cup and spoon, not the bottle feeding. If not breastfeeding at all, refer for counseling. Then advise mother about giving locally appropriate animal milk and teach mother to feed with a cup and spoon, not through bottle. If thrust, teach mother to treat oral thrust at home. If you find low weight forage, teach mother how to keep young infants with low weight warm at home. Because if low weight, there is chance of hypothermia. So you need to be very careful. Advise mother to give home care for the young infant. Follow up any feeding problems or thrusts in 3 days and follow up weight forage in 14 days. No low weight for age, no other signs of inadequate feeding. That means no feeding problems. Only some, positioning problems or other, process issues. You need to teach them. It will be corrected automatically, okay, in your future. Then advise mother to give home care of their young infants. Advise when to return immediately and praise mother for feeding the infant well. It's good job. Say good job. You are doing great. You need to praise the mothers for doing good. To prevent hypoglycemia, teach to feed the expressed breast milk in a through cup or a spoon, or feed via NG tube, nasogastric tube, if you are trained. Otherwise, it's quite difficult to feed through NG tube. If young infant is unable to feed, refer urgently to hospital for better treatment, giving first dose of injection gentamicin to prevent possible bacterial infection. To treat oral thrush or white patches, advise mother to wash hands. In the context of COVID-19, we need to be very careful. Wash hands thoroughly and use simple salt water to clean it. Okay, just use salt water to clean the thrush. Actually, it will work better than commercial medicines. So next week we don't have any class, and hopefully in another week we'll continue our IMNCI class. So today we try our best to cover different process: feel, look, ask, look, listen, and feel about different conditions of 0 to 2 months children or young infants. The recordings and the slides available in my website and page, so you can read it again and again. To be familiarized with some technical terminology, medical terms, jargons, and the process, please try to correlate with your other subjects, especially ICM. If time permits, in my upcoming class, I'll try to show you the different processes through video. And maybe in your practicals, we'll visit to nearby health center and we'll try to find the actual process at nearby hospital, Tongkisin Mariam Post, hopefully. Okay.